If you're a veteran struggling with chronic back, knee, or joint pain, and you're tired of being told to just take it easy or pop more pain pills or injections, this video is for you. I was in your shoes. I want to show you what exactly helps me heal from chronic pain. I'm Dr. Peralta, a physical therapist, run coach, exercise physiologist, and Marine veteran. For the past 10 years, I've helped hundreds of people rehab injuries, get back in shape, and reclaim their health after years of chronic pain. But before that, I was also the one in pain, dealing with low back and knee pain that nearly ended my career. And it did actually end up my career as a Marine. And I know what it feels like to be broken, to get mixed advice, to feel like there's no way out. So in this video, I'm going to walk you through the four-part framework that helps vets in their 30s and 40s overcome chronic musculoskeletal pain, right? Back pain, knee pain, etc. It's the same approach I used to heal myself and what I teach my clients now. No pills, no injections, no surgery, just science-backed lifestyle changes that work. So chronic musculoskeletal pain is one of the most common health complaints among veterans. Over 50% of vets report persistent pain, especially in the low back, knees, and neck. And unfortunately, many are only offered painkillers or injections or just told to rest. But rest alone isn't enough. And neither are getting various scans or x-rays or MRIs, right? You think they're showing what the problem is, but oftentimes they're showing things that could just be age-related changes and not necessarily the root cause of what's causing the pain, right? You may have arthritis in your knees or a slip disc in your back, but that's not necessarily a cause of the pain. And they're trying to mask the symptoms, giving you medications to try to dull the pain. But the real solution is a full body, whole person approach, a holistic approach. So here's a 4-step framework for overcoming chronic musculoskeletal pain. Number one, you want to calm the nervous system down, right? You want to calm the nerves. So sometimes the healing comes from just relaxing the body. So chronic pain is often tied to active muscles that are in a fight or flight state. They're trying to protect you. They think you're like in a war zone or something, but that's why learning how pain actually works is key. See, most pain is not from tissue damage per se, but from your brain's perception of threat, right? If your brain's perceiving that there's a threat involved, it might tighten up tissues around your body. And tools like breath work, meditation, and journaling, and even taking different positions like in yoga where you just learn to relax your body and elongate your body is key to help your body relax, break through areas of stiffness, tightness, restrictions, and help decrease and finally break free from the pain cycle. And this ties into number 2, move your body intentionally. A big fan of movement, especially as a physical therapist. With the proper movement can help the body heal, right? But you have to implement it, and you just can't wait. Oh, I'm just going to do some random stretches. You have to stay consistent with a routine. See, movement helps heal the body, and things like aerobic exercise. And it doesn't even have to be super intense. You could do something like brisk walking, jogging, easy running, like what I call zone 2, or cycling or swimming can help reduce pain sensitivity, right? Try to get about 150 minutes or 30 minutes, 5 days a week of aerobic exercise. Again, it could just be a brisk walk. If it hurts too much to do running or jumping, or walking, you could also go on a bike and do cycling or biking. It's low impact. You could do bike, or if you have access to a swimming pool, you could swim. Also, you want to do strength training at least 2 to 3 times per week, and mobility work, right? This is where the stretching comes in. I'm a big fan of yoga, but it doesn't have to necessarily be yoga. Any types of stretches that help address your tight areas. So whether it's your back or your knee, spend 10 to 20 minutes a day doing mobility work, but then also you want to strengthen the areas around your painful, let's say it's your back. So you want to strengthen your core, your hips, your glutes. Strength training 2 to 3 times per week to build up your strength and resiliency. And you stay consistent with that. And most injuries or most even these chronic pain conditions can actually heal within 3 to 6 months if you stay consistent and commit to actually doing your exercises, strengthening, mobilizing the tight, painful areas. These things can rehab. That's oftentimes what I'm doing with a lot of my patients or clients who I work with who have chronic pain. See, so mobility, strength training, aerobic exercise builds a foundation to support your joints. For example, people with low back pain often find they have to do like a prone press up or a cobra stretch, right, to stretch out the lower back. Posture correction, make sure they have good posture when they're sitting and standing throughout the day, and make sure they get general movement throughout the day, just getting more steps in. Just go for a walk, right? Walk for 10 or 15 minutes. Do that 3 times a day, get 30 minutes of walking a day, right? And then glute and core work, right? Strengthen, let's say you have knee pain. Oftentimes with the knee, you have to strengthen your quads, hamstrings, glute, and even have to strengthen your ankle because even the muscles from your ankle, like your calf, also attaches to your knee. And then oftentimes you stick with that again for 3 months. And wow, that pain that you thought was a lifelong condition can finally actually start to rehab and heal. But if you're not sleeping enough, this is where number three comes in. Sleep is another pillar for proper healing. If you're not sleeping enough, you're not healing, right? If you're constantly sleep deprived, getting less than 6 hours a night sleep a night, you're not going to go into that restorative sleep, right? Because you need to get to deep sleep. If you're not getting deep sleep, your body's not going to properly heal, right? You're going to have incomplete repair. So if you want true repair of your tissues, you need deep quality sleep. This is where the body actually repairs, improves immune function, so you're not getting sick all the time, at lower inflammation, right? So instead of looking for recovery gadgets or hacks, make sure you're prioritizing deep quality sleep. Aim for at least 7 hours a night, but some people may need actually 9 hours a night or more. Usually it's 7 to 9 hours. Very few people have to go like to 10 hours, but 7 to 9 is usually the sweet spot. And this is where half the battle is won, right? So many people think, oh, I get enough sleep. But when in reality, they're actually sleep deprived, only sleeping 6 hours a night. Make sure you're in bed and, asleep for at least 7 hours a night, right? Set a same consistent sleep time or bedtime and awake time, right? The consistency, even on the weekends, right? 7 days a week. Don't try to, I'm going to mess up my schedule because it's the weekend, Friday, Saturday, Sunday. I'm going to mess up the schedule. No, keep the consistent schedule, especially if you're trying to prioritize deep healing. And then number 4, find mission again, find purpose. See, pain thrives in the absence of purpose. When you don't have purpose, you're feeling lost, you're wandering, you don't have any goals. The body actually tends to perpetuate pain cycles. People don't think about pain being tied to thoughts and emotions or purpose or drive, but it is. See, when people sometimes get into pain, they get into disability states and they have like this disability mindset, and then they're often not doing goal-directed behavior, goal-oriented behavior, trying to work to better themselves, to improve themselves. They're stuck in this like disability or victim mindset, waiting for something to come fix them or heal them. But you need to set goals that excite you, whether it's maybe you want to go for a comfortable walk for an hour, walk pain-free, or maybe complete a local 5K or even run a marathon, right? Set goals that give you purpose or direction to actually move, right? So a reason to move, everything changes. You start, following a plan, maybe to help you train for a 5K. That purpose pulls you through and helps you do all the other steps, right? The sleeping, nutrition, exercise, to finally allow your body to heal. And if you're overweight, yes, losing some weight can also help take pressure off your joints, right? So if you're overweight, aim to lose about 5 to 10%, depending how much overweight you are. But even just losing 5 or 10% of your body weight, if you're overweight, can also take pressure off your joints and help you along the healing process. So my story, after Marines, I had pain. I had chronic low back pain and knee pain. I was in the Marines, in the infantry, training to go to war. I was training to go to Iraq, but I ended up getting hurt. I also ended up getting depressed and all these mental health issues that go inside with getting in pain and all this guilt and stuff. And, going to doctors, they gave me conflicting advice. Oh, take it easy, rest, or take these pain pills. And or maybe consider getting back surgery. But I was in my 20s. I didn't want to do that. And it wasn't until I worked with a PT and some other sources that show me that the body can actually heal itself, that movement or exercise can be medicine, that everything changed. But I had to commit to it. I had to stay consistent. I couldn't just do it a few days here or there and then drop off. I had to really commit to the process, and then my body finally healed. I took ownership. I built a daily routine. I focused on the sleep, movement, nutrition, mindset, and having a mission in life. It was hard, but worth it. Better than being stuck, being addicted to pain pills or, trying to get injections or, maybe getting a back surgery that may or may not work. Because a lot of times back surgery is only like 50% successful. So if you want to learn how to run pain-free or just take control of your health again, tap the link in the description or check out my free training. That's where it's going to show my free training on how to overcome pain and start moving again pain-free and stronger and faster than ever.